Well, back with Dr. Stepovich. Dr. Stepovich, let's talk a little bit about adult dentistry. About adult orthodontics. Most of, we definitely know that the children and the teenagers with braces, and that's the time to straighten it out, obviously. But at the same time, there's truckloads of baby boomers like me, or maybe not quite baby boomers, but 30, 40, whatever it might be, 25, 45, anyway, whatever age, for some reason they missed straightening out their teeth. Now they have an option. $20,000, $30,000 in bridges, crowns, and implants, and veneers, and all that stuff, or a lot less with braces, but run around a year or two of braces. What's happening on that front? How do the public and the dentists react to that phenomenon? And is there a trend in adults taking braces?
I've always had over 30% adults, and today it's higher. I'm in the 40% area. The adult treatments come from a couple of areas. I saw a patient today that was treated as a teenager, and she says, well, I didn't wear my retainers, and now I'm in doing it for the second time, because they know that the teeth did look very nice to them, but now they're not, so they've come in for their treatment. Others did not get treatment when they were young, and now they have the means. They may have a job that has insurance, orthodontic insurance coverage, or they might have medical reimbursement available at their job. So they're now taking advantage of that and coming in and having their teeth aligned. And Invisalign has sparked a lot of adult patients to come in to seek Invisalign treatment with no braces and just using those plastic see-through aligners. But on that front, I examine patients that want to have those Invisalign braces. However, only 10% of the patients that I see qualify. You can only do so much with an Invisalign treatment. But we have, for adults, we have clear braces instead of the metal, and so some want to go that route. And but yet, most of my adults go for the metal braces. They look like jewelry on the teeth to them when they see other people wearing them, and they don't seem to have any problem with seeing people, other adult patients with metal braces. And the metal braces are really the best. They're far better than, you can detail things better than you can with Invisalign. And the clear braces are made of glass, and they tend to break after a certain amount of adjustments. But adults they do want to have, again, the teeth that look good for them. And
sure.
That's why they're here, and it is a big part of orthodontics today. When I started my practice, my school taught adult orthodontics, whereas the other schools did not. And when I got into practice in San Jose, the orthodontists, anybody over 25 years old or 20 years old, 20 to 25 years old, they sent them to me because I understood how to treat adults. The secret is there's no difference in the treatment between adults and children. Bone reacts the same for an adult as a 12-year-old. If you break a bone, or I break a bone, or a child breaks a bone, we still go 6 weeks in a cast normally, and then you take the cast off. So a healthy person, the physiology and the biology of moving teeth through bone is there with any healthy adult, no matter what the age.
Okay. So, and does adult orthodontics save a person money versus doing the other cosmetic options which are out there? Never mind saving your own teeth, which is a good thing all the time, I suppose, right? But does it also save money?
Well, to go and have your teeth cut down, that are malaligned or crooked front teeth, to have them either put veneers on or crowns, and putting the crowns on in a straight manner, and when the teeth are not that way, and using a laboratory to do that, you still have to cut the teeth down somewhat.
Right.
And that is a costly procedure. The lab procedures are costly. The dental appointments have a time, and that's costly, because it takes a while to have those done. Those appointments are long appointments. And then in the area of implants, they are also costly, and then they require a crown to be put on the implant that comes out of the bone, the implant being an artificial root, and then the crown has to be made on top of that. And you really have a lot of things that really don't last a lifetime. But teeth, natural teeth, will last a lifetime if taken care of.
Well, that's a good point. That's an important point in that whole equation.
Right. And so you get a crown, and where the crown meets where the lab makes the crown, and it has to go underneath the gum tissue to look well. Well, that point there, you get recession of gum tissue, and now you show a black line around the teeth because the gum tissue has moved away.
Mm-hmm.
And now you have to have that replaced. Now, if you can get 25 years out of a crown, that's a long time. So you have to have it replaced. So you not only have the initial cost, but you have the replacement. But if you have a natural tooth there, if you take a space that would normally in a dental office would have an implant in there, and you close the space and you had a natural tooth, that's a much better, long-term solution than to put in
right. Well, the way you're putting it makes a lot of sense. Number one, you do keep your natural teeth, which, because dentists, they do good jobs with implant crowns and bridges, so sometimes that kind of gets lost of like, what the hell, and we're so used to have foreign objects in our body, but the fact is, a foreign object is a foreign object is a foreign object, and you pointed out that 25 years is a long time to get out, so let's just say you get only out 10 or 15, you have to replace those suckers 2, maybe 3 times. Now, mind you might on the road put implants in it, and they hold a long time, but they cost a fortune, and they still are a foreign object.
That's absolutely correct. And so you add all that up, orthodontics is a bargain in that respect.
So basically, there may be, if some people think, and it might be, I never had prices, so I wouldn't know, but that having those metals in it and maybe not looking quite so good at the same time. You said it well. Just imagine it's teeth jewelry. And,
yes.
But either way, let's assume it is a little bit of an inconvenience with brushing and with eating and getting spinach stuck in the wire and blah, 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 whatever it is you hear. But, it's, for a year or 2 years, I guess, something in that neighborhood. It seems to be not necessarily a small price to pay, but it seems to be a valuable price to pay in order to not to grind your teeth, not to spend a lot of money, not to have to redo them, the crowns, bridges, again, and maybe doing an implant in a very expensive way years down the road, anyway. So tremendous amount of money saving, keeping your own teeth, not having the risk of having operations, which is always babies are not born with a deficiency of operations and foreign objects in their body. And
That's a good way to put it.
Well, all right. That was you explained this. You made a really good case for maybe doing adult orthodontics. You really did. If I would have crooked teeth at this moment, and maybe I do. Anyway, I would go for it. Thanks, Dr. Stepovich. Thanks a lot.
Thank you.